Degenerative low-grade lumbar spondylolisthesis is the most common form of spondylolisthesis, especially affecting the L4-5 level of the spine. This condition involves the forward slipping of one vertebra over the one below it, often due to age-related changes in the discs and facet joints. Most patients with this condition are actually asymptomatic and discover it incidentally during imaging for other reasons. However, when symptoms do occur, they can include lower back pain, leg pain, and neurogenic claudication. The process is typically gradual, with instability and degeneration leading to the vertebrae shifting position. Factors like facet joint orientation, disc degeneration, and increased mechanical loading all contribute to the development and progression of this condition. Understanding these underlying mechanisms is crucial for deciding on the best management approach for each patient. Assessing stability in degenerative spondylolisthesis is a nuanced process. Not all cases are unstable. In fact, many are static and do not progress. Radiological imaging, such as standing lateral X-rays and MRI, helps determine the degree of vertebral movement and the presence of stenosis or nerve compression. Classification systems like the Wiltse and Merding grades, as well as newer systems such as CARDS and DSIC, help clinicians stratify patients and guide treatment decisions. Factors such as disc height, facet joint effusion, and the presence of restabilization signs are considered. Patient-specific factors including age, symptoms, and comorbidities also play a role. Ultimately, the goal is to identify which patients may benefit from conservative management and which may require surgical intervention, always aiming for the best possible outcome. Most patients with low-grade degenerative spondylolisthesis, non-operative management is the first line of treatment. This can include physiotherapy, pain management, and sometimes epidural steroid injections. The evidence supporting these approaches is mixed, but many patients experience symptom relief without surgery. When symptoms persist or worsen, especially if there is significant nerve compression or instability, surgical options are considered. Ergo strategies range from decompression alone to decompression with fusion, and even minimally invasive techniques. The choice depends on the patient's symptoms, imaging findings, and overall health. Recent studies suggest that while fusion can reduce reoperation rates and improve satisfaction in some cases, decompression alone may be sufficient for others. The decision is highly individualized, emphasizing the importance of a tailored approach for each patient. Summary: the management of symptomatic degenerative low-grade lumbar spondylolisthesis remains a topic of ongoing research and debate. The decision-making process involves careful assessment of clinical presentation, radiographic findings, and patient-specific factors. While decompression remains the mainstay for those with nerve compression, fusion procedures may be added in cases of instability or persistent symptoms. Minimally invasive techniques are gaining popularity for their potential to reduce recovery time and complications. Ultimately, a clear understanding of the patient's goals and the underlying biomechanics of their condition is essential for optimal outcomes. Treatment algorithms, like the one proposed by the authors, can help guide clinicians through this complex process, ensuring that each patient receives the most appropriate and effective care.